National Cancer Survivor Day is celebrated on June 6th, 2022. We talk a lot about what are the types of cancer, how do you diagnose cancer, what can be the symptoms of cancer, how do you treat it. But do we talk about the last leg of cancer, which is the best part, right? Somebody who's gotten through something as grueling or as tough as cancer treatment and has actually come out at the end victorious through the process and has beaten cancer. So we call them cancer survivors or cancer warriors, I think is a better term that suits anybody who's fought cancer. So who is a cancer survivor? Anybody who has been free of cancer in the recent past previously used to be considered as a cancer survivor. But if you refer to most of the international guidelines, a cancer survivor is someone who has conquered cancer and has been cancer free for at least about 5 years. Do cancer survivors still need to follow up with their oncologists? So once you are done with treatment, once you have been declared as a cancer survivor or that you're free of cancer, do you still need to follow up with your physician or more so your oncologist? Absolutely. So as we know, cancer is a deadly disease, mainly because it can be difficult to treat the first time around, but also because if it comes around a second time, so if there is what we call a relapse, then it can be very difficult to treat it, especially the second time around, because cancer is a very intelligent or smart disease where it can find bypasses to the first time treatment that the patient has received, and the second time the same cancer recurs, it can be very difficult to treat the same cancer with similar medicines that were used in the first round. So it's all the more important for a cancer survivor to make sure that they stay in regular touch with their oncologist so that they can give them a schedule for follow-up or what we call surveillance scans or visits. So is there a chance that cancer can relapse? Absolutely, yes. As I mentioned, cancer is a deadly disease. One of those reasons is because it can come back or it can have a relapse. Can all cancers relapse? Yes and no. So it is not mandatory that anybody who has cancer, it should always relapse. But a lot of cancers are more likely to relapse than the others. And most of those are cancers in adults are usually likely to relapse, like stomach cancer, pancreatic cancer, colon cancer, kidney cancer, lung cancer, breast cancer. So the risk of relapse of these cancers is much higher. Some cancers like pediatric cancers, like pediatric leukemias, once cured, especially certain types of leukemias, are very less likely to recur. However, they still have to be followed up by an oncologist. So how often should a cancer survivor follow up with their oncologist? The best answer to this would be please check with your oncologist, because each cancer has a different risk of relapse. So if you have a certain type of cancer that is more likely to relapse, say 6 months after completion of treatment, your oncologist will probably suggest you to undergo surveillance scans or say a PET CT or a CT scan at the appropriate time point. If there is a certain type of cancer that is likely to relapse, say a year after completion of treatment, so the oncologist would recommend follow up accordingly or based on that. So the best answer would be yes, follow up is absolutely required, but each cancer patient does not follow the same schedule. The schedule of follow up would depend on what age the cancer patient was when it was diagnosed, what kind the cancer was, what treatment have they received, and how fast they went into remission. So a lot of factors go into making this decision of when exactly a patient should follow up with their oncologist. Since I'm a pediatric oncologist, I'll also talk about pediatric cancer survivors and what makes pediatric cancer survivors, different or special as opposed to adult cancer survivors. So when children undergo treatment for cancer during their childhood or during their adolescent years, we give them chemotherapy or radiation, or they have to undergo this procedure called bone marrow transplantation. Most of these medicines can hurt their reproductive organs. So they can have what we call, delayed puberty. So they may not undergo the changes that a normal child would go through, either development of breast tissue, normal development of ovarian tissue, starting ovulation at the same time, starting their periods or menstruation at the same time. So these things may not happen for a cancer survivor at the same time as it would happen for their normal pediatric counterparts. So it's very important for a pediatric survivor, cancer survivor, or an adolescent or a teenage cancer survivor to continue to follow up with their pediatric oncologist, because we know exactly what side effects to expect from the treatment we have given them. We ask the patients to probably undergo a few blood tests at certain intervals, usually about every 6 months or 1 year, to check their hormones. And if we see signs that patient might have delayed puberty or that they may have problems with their reproductive health, then we send them to an endocrinologist or who is a hormone specialist. Sometimes children may also undergo, go through difficulties in growth. They may be of short stature. They may not really grow to a particular, height as they're expected to because of variation in hormone levels or their nutritional status. So this has to be handled or taken care of by a pediatric oncologist, because we are trained specifically to treat kids with cancer, and we know what exactly can be the side effects of the chemotherapy or the medicine or the radiation we give on our little bodies, or our children. So it's best to continue treatment for or follow up for a pediatric cancer survivor with a pediatric oncologist. Apart from this, there are also a certain risks of secondary cancer. So chemotherapy, certain types of chemotherapy that is given, certain types of radiation therapy that is given can put a patient at risk for secondary cancers. Most of them are either leukemias. So we call a certain type of acute myeloid leukemia. It's called treatment-related acute myeloid leukemia. Patients can have what we call MDS or myelodysplastic syndrome. Some patients can also have what we call meningioma, which is the type of brain tumor that can happen from radiation that is used to treat various types of cancer. So it's important to know that just cancer treatment can also sometimes lead to what we call secondary cancer, which usually tends to happen about 2 to 10 years after the treatment is completed. So it's important for a survivor to watch out for the symptoms and make sure to contact your oncologist at the right time, so that secondary cancers can also be diagnosed or caught as early as possible and appropriate treatment can be started. If you have any further questions about cancer survivorship, how exactly to follow up, what are cancer survivors supposed to do as far as surveillance scans or tests supposed to happen, please feel free to contact me. I'm Dr. Neema Bhat, Hematologist and Pediatric Oncologist.